Hi, and welcome to this episode of your Health and Wellness Talk. I'm Dr. Daniela Steyn, and today I have with me Farah. Welcome, Farah.
Thank you so much, Daniela.
Farah Jamani works here at Wellness MD. She is a functional medicine health coach, but you're not only a functional medicine health coach, you're also a holistic pharmacist. You did training at the University of Toronto as a pharmacist. You worked as a pharmacist in the community for 20 years. And then you've also, apart from your further training in functional medicine, you've also done further training in mindset coaching.
Mm-hmm.
So you're incredible. And if any of our listeners, watchers out there want the ultimate solution, Farah can help you cover it all. Something we're going to talk about today is something that both of us are very passionate about, and that is burnout. So burnout comes under many different names. Where I work in a hospital, we are more familiar with the term burnout because as physicians in a big hospital or healthcare providers, it is something we come across quite often. So we get quite a lot of education on burnout. But I find that a lot of your clients doesn't have that label. They didn't come with you with that label, that diagnosis of burnout.
Correct.
People come to you with other things. They come to you with difficulty sleeping, migraine. So when people book an appointment with you, they wouldn't necessarily book and say, oh, I've burnout, treat my burnout. What do people come with to you?
You know, burnout is a spectrum. So to the listeners who are listening, see where you identify yourself on the spectrum. Sometimes burnout can start with, I'm just feeling really fatigued. I have this exhaustion. Or, as we start to march on down towards the road of burnout, sometimes they're feeling that they're irritable, they're moody, they're more apathetic about life, that they're just not showing up properly in their careers or at home. Sometimes we have some really insidious symptoms, some digestive issues. My stomach always hurts. I'm always bloated. I have trouble going to the bathroom.
That's big. People will come to us, they'll call Wellness MDC, say, can I please see your dietitian? Can I see your nutritionist? And I always first ask, who have you seen? And they would say they have seen their family doctor, they have seen a dietitian, their dietitian said there's nothing wrong. Or I would see people in the hospital, they'll have a colonoscopy, the gastroenterologist will tell them there's nothing wrong, go home. And they'll tell me, but there's nothing wrong. I have significant symptoms, which makes it hard for me to go to work. And then I say, okay, in hospital, we only diagnose cancer, inflammatory bowel disease, but you're on a spectrum with gut symptoms, exactly same as with burnout. Anything in life, we're on a spectrum. At the one end of the spectrum, you might have colon cancer, you might have inflammatory bowel disease, Crohn's, ulcerative colitis, celiac disease. But then there's quite a lot of things in between and perfect health. And that's really where you come in. To help people with symptoms. But then as you do more testing, gut testing, if we do stool testing, all the different testings to find the root cause, quite often one of the root causes could be burnout.
And it's really interesting how you draw those links. And if we sort of think that we have stress hormones throughout our entire system, and it was designed evolutionarily to be able to run away from a predator or a bear or whatnot.
So stress is not inherently bad.
No, you want some stress. Where our challenge comes in our modern day society is that we just have chronic stress all the time. We start our day, we get stuck in traffic, we have emails from our bosses, we have kids, we have all these things, and we just don't have time to come down. We don't have time to be able to dispel some of that stress, so it builds up in our system. And I teach it in ways of, we have all these internal fires that are going off from a physical and mental and emotional side. And so those can start to show up with those gut symptoms, the bloating, the headaches, the hormonal imbalances that you can start to have with our female hormones and other hormones. Maybe you're starting to see that your blood sugar instability, you're hangry all the time. You can't go a couple hours between meals.
And that's a big one, yes.
And so all of these pieces form this puzzle of the root causes of what's creating burnout. I teach it in the way of, there's a biology to burnout. We often think, well, if I just had a nap or I had a vacation, then I'd start to feel a bit better. And perhaps that's true. But if we can build you out some more resilience and capacity in your system from a physical perspective, you are able to handle the demands of life more effectively. You are able to show up better to work and be more productive. You are able to perform as a mom, as a partner, as a friend, a sister, whatever those roles are that you have in your life. you're able to do all those roles with ease. We all have a lot of balls that we're juggling in the air. We're ambitious women who are doing so much in the modern day. But if there's a way to make it feel easier and build out more capacity and resilience in your system, those feelings of exhaustion and apathy and mood irritability, gut symptoms, and all the rest, they start to fall away.
So if someone comes to us, if someone reaches out to our clinic and they say that they have whatever symptoms, migraine, gut symptoms, we do extensive testing. We don't guess, we do extensive testing. Mm-hmm. We find out their root cause would be burnout. Tell me a little bit more. How do we see it as healthcare providers? What testing do we do?
So this is where the lens of conventional medicine versus functional medicine.
And we do both at Wellness MD. We don't say either or. We give you everything, the full package.
Which is that integrated approach, right? One is not better than the other. It's just we need to have that merged approach together. So through the conventional side, we do make sure that there is no abnormalities within your lab values. From the functional medicine side, then we start to dive into your nutrition, your sleep, optimizing some movement, because everything can be a fire in your system. Too much movement isn't great, too little movement isn't great. We start to then dive a little bit more deeply. Once we start to reset some of that cellular health in your system, we start to dive a little bit more deeply into some of the systems health. How is your detoxification? Can we optimize that? How is your digestion? Can we optimize that? How's your hormonal balance? Can we optimize that? And from there, we dive into more of that mental and spiritual side of things, of what got us here in the first place. What are some of those beliefs that maybe we don't need to hold anymore? And the masks that we start to wear and show up in this world. Maybe we have to rewrite some of those stories to break free of that burnout pattern that we see over and over, especially in ambitious women.
Which is big. A lot of the women we see are peri, postmenopausal. They're at the height, at the peak of their career. They'll tell us that they do spin class every morning, 5 o'clock. They do endurance running. And these might have things that served you very well until 45. But then one day, suddenly, your body starts seeing that. And actually not that suddenly, but over time, and I'm an endurance athlete. I run. I love ultramarathons, triathlon. But I've just seen with client upon client, patient upon patient, how that can become a stressor to your body, where sometimes we have to cut back on our cardio. Yesterday I had a client who does strength training 7 days a week. So she's a health coach herself. She knows the importance about strength training, but now she's also type A personality. Yes. So doing it 7 days a week. Now she has chronic fatigue, quite a lot of problems. So whatever you have been doing might not serve you well when you have burnout or when you're getting in those perimenopausal years. I think it's important to be cognizant of that. The thing that you mentioned specifically regarding mindset coaching. So I find that quite interesting. People don't come to us and say the problem is just in my mind. They come and say that the problem is in my body, and we can see that when we test it. That's why we always test. Quite often people would be anemic. They would not be absorbing nutrients well. They'll be low in vitamin D, low in magnesium. So we always test. First for minerals, vitamins, hormones. We do lots of functional medicine testing. But then quite often we would see that we remove toxins. We remove alcohol, smoking, drugs, toxins, plastics, chemicals. But then we often find that toxins can be in your relationships, and it can also be in that inner dialogue in your mind. So even if you eat perfectly healthy, even if you do everything right, you don't exercise too much, you don't exercise too little, you do everything perfect, but you're critical towards yourself. From the morning that you get up, you have this inner critic. Your whole body listens to that conversation in your mind. And that is why you are so successful when you work with clients, because you address that component. And that is specifically what I learned when I became double board certified at the American Board of Lifestyle Medicine, that we teach that it's one of our pillars of health. We cannot only address nutrition. We cannot only push pills. We have to address your whole psychology. And that's quite key. That is what you do with each and every one of your clients. So you don't only push supplements or this or that. You really talk to them about that dialogue, which and what you call it is limiting beliefs. So I'm big on criticism. I just teach people, don't be critical. Read that book by Kristen Neff, such a good book, How to Have Empathy with Yourself. Once you have empathy with yourself, it's easier to have empathy with others. But you take it a step further, and you don't only say, be nice to yourself. You also say, but maybe you could be bigger, better, more bold, achieve more. And what do you need to do to get there? How are you holding your back? Because quite often people will tell you, oh, it's my kids, it's my work, it's my husband. Yep. But then when you sit down with them and you say, is it really your husband's fault? Is it really your children? What are we get that.
Yes.
Both of us have little children. Both of us have husbands. We do realize that quite a lot of our love and passion and energy get invested into them. But what are the things where we keep ourselves back?
Well, to your point, when I work with a client, one of the questions I often ask is what gives you energy and what drains out your energy. And we have to even get to a point in your physicality where you can have those conversations. Once that you feel you have some more resourcefulness in your body by putting out those physical fires that we discussed, then we can start to move into some of those stories that we tell ourselves. Or the flip side is, now that you feel amazing, you wake up with energy, you have consistent energy during the day, you're not as irritable with your family. When you're empowered, then you can start to think, well, what's the next biggest mountain for me? All of my health had held me back for so long. Now what do I want to do with my life? How do I want to start to live even bigger and bolder? But often some of us haven't even had that conversation, or we haven't even been able to think that way because we were so held back. So those are those types of conversations as we identify those stories we tell ourselves. What are those thoughts that we think every day? Are they helpful? Are they hurting? Are they draining energy? Are they giving energy? And we create that holistic piece of creating energy from the inside out. So I teach about having a little energy ball. And when you're so burnt out, your energy ball is so little. So how do we triage that in the best way possible? As it starts to grow, your possibility and your potential starts to grow. And therefore, our job here is to help your energy grow and then help you create what that next step forward is with the support and the accountability to be able to do so. Because sometimes those steps seem really big. So let's break it down. If this is your end goal, what are those micro steps that will get you there? That 1% better each day. By doing that, you will achieve your goal with enough time. And with enough support, you will make it. And that's what we do here.
And you're so successful in guiding people through that journey. Each one watching it today, we want success for you. We don't want you to just survive. We want you to thrive. We want you to be the best version of yourself. So reach out, get some help. If you're watching this, I know we have podcast listeners and YouTube watchers all over the world. Reach out to someone local. If you can find a functional medicine provider, go on ifm.org, or you can reach out to a local psychologist, counselor, coach. Advocate for yourself. That's the key that we want to bring home. We want you to be healthy. We want you to be strong. We want you to be the best version of yourself. Don't wait for things to get so bad that I need to admit you in hospital. That's quite often, when I have people who are so severely depressed that they need to be admitted in hospital. When we go back through their story, there's been quite a few warning signs along the way. And I really want to encourage our listeners, if you notice any warning signs, reach out. Reach out to your doctor, reach out to your healthcare provider, reach out to someone you can trust. Go and do proper blood work. If your doctor tells you your thyroid is normal, everything is normal, but there's something off, advocate for yourself. Find the answers. There's so many resources on our website, www.wellnessmdhealth.com. Send us an email at info@wellnessmdhealth.com. Subscribe to our newsletter. There's a lot of things we send for free. Podcasts, YouTube videos, things that I want you to implement in your life, where you can take ownership of your own health to help you live your best life. Thanks so much for your time, and thank you, Farah, for spending time with us.
Thank you for listening to this episode today by medical doctor Daniela Steyn. Follow us on social media and subscribe to our newsletter at www.wellnessmdhealth.com to stay up to date on educational resources that will take your quality of life to the next level. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your healthcare provider. Never disregard medical advice or delay in seeking it because of something you have heard on this podcast. Remember, you are created to thrive.